Welcome back, everybody. Welcome to our wonderful grand opening. I'm Lauren Collier, your host, and here I am seated with the CEO and founder, Josh Klein, and the COO of Emerest, Jack Bernath. I'm so happy to have you both here.
Oh, it's amazing.
Welcome, congratulations. November 1st, opening day. It must feel really good. This is such a great facility, and your mission is so fabulous. I'll start with you, Josh. How did you decide? You've been friends for a long time. So how did you say, we're going to do healthcare, but we're going to elevate it?
So it took time for us to come up with ideas, but you mentioned the word friendship, and I really want to expand on that.
I love that. I do.
And Jack and I have done this together from day one. I was fortunate enough to get introduced to Jack through his brother.
Oh, okay.
From day one, there was never an idea or never a concept, especially within the caring industry, that Jack and I were not on the same page.
Wow.
There wasn't any concept of what we were trying to accomplish in this space when we started in a little office on the Utrecht Avenue, which was a storefront.
Wow,
it
and
was
look what you have now,
1,000 square foot.
That small office.
Where was that?
In Brooklyn, New York.
Okay.
In Brooklyn, New York, on a storefront, and Jack and I didn't have an office.
Right.
Wow.
Right. We were actually working out of the car, actually out of between different offices, but we didn't have our desks actually.
Oh wow.
It was like a small place because we were growing very, very fast.
Oh, but you had these ideas and you had this wonderful mission, because you didn't just want to do great healthcare and services. You wanted people to feel good about what they were doing and what you were offering, and I think that's really wonderful. I say bravo.
Thank you.
I really do.
And I will tell you that Jack and I, one of the real reasons why Jack and I have been successful in this business, Jack likes to really explain this well in a certain way. And I know you're going to laugh what I'm going to say now. But first of all, we finish each other's sentences. That is number one. We really do finish our sentences because when you really have the same mission.
Yeah.
So when we started doing Royal Care, Jack and I, like Jack said, we were in the field. And sitting in the back office wasn't an option.
Right.
And when we went out to the communities and to nursing homes and to hospitals and to doctors' offices, Jack and I used to get patients that we wanted to provide home health care, which is the paraprofessional care, as it's called in the industry, that does the daily activities for elderly patients at home that just can't do certain things, washing laundry, doing their daily activities. And Jack and I, for years, we actually, how many times did we ourselves, with our own hands, with our cars, have taken patients out of a nursing home to put them in our car and set them up
home and set them up.
I love that.
So we never lost that mission. You're asking about our mission.
Right.
We never forgot what it feels, and Jack and I have always been in patients' homes to really get a feel, never forget that we had a business to build. But this is, as Jack, I'll go back.
It's a business, more than a business.
Yeah, I mean,
our mission is, of taking care of patients.
And I could feel that.
And the way we have started, as Josh said, we have started with every little department in this company, which has, multiple departments, to understand. We started with, we did some of the HR. We wanted to understand, what does it mean, the home health aid sides? Who are going to be these employees? What are they going to be doing for patients? We're doing the payroll. What does it mean, to take care of getting people paid? Understanding what does it mean intaking a patient, getting the referral. All these departments, we were sitting for days and months and weeks and years. Yes,
but you started as babies.
Learning.
Yes, we did.
Learning and understanding. Yes, we were. And understanding, what does that business mean?
Yeah.
What is this particular business? And we really, when we started this, we really understood that this is not just any kind of business out there.
Right.
We're not selling boxes. We're not selling cameras. We're not a grocery store. We're actually dealing with lives of the elderly population, and we took that very, very serious.
And you can tell with everything.
And the passion we had to that, and as Josh said, I got introduced to Josh through my brother, and the minute we started talking. And I actually didn't come from this industry. Josh actually is in this industry for many, many years. His parents actually did healthcare for many, many years.
Right.
But when we started and I got introduced to Josh and we were like talking for hours, and the passion was right there, for me as well, to understand where we're going into. And we have worked very, very hard to understand what this is and to start that line of business. And as we're gonna talk, and you'll understand where we ended up today's day, which
and
is,
I mean, because I know your passion, and I always wonder how you got that passion. Did you have a personal, experience? Because a lot of people don't understand the importance of what you do and the importance of healthcare. If as your parent maybe gets older, someone not feeling well, you don't think it, and then when it happens.
So the answer is that Josh is coming from that, and unfortunately in my family, my parents actually passed very young, and they were sick, and they had home care, and they had a hard time getting home care in those years. First of all, we used to live in the rural areas where it's very, very hard home health care.
To find somebody,
to find nurses, to find home health aides, in those days in the rural areas, they came, they never showed, that kind of company. So all that kind of things, happening. I had that passion, but I never did that. But as we got into it, we merged all those little things together and made it as a good mission.
It was never something that we had to explain each other as to why we want to get to an objective.
Right.
There was no such a thing as, there was never a concept. And Jack and I mean, it's 20 plus years.
Wow.
It is, right?
Sure.
That's
it's 20 plus years.
tremendous.
Not just do we talk every day, besides that, and I'm glad that he's used the word friends, we don't just talk about business. And I think because it's a caring business, there's a lot of understanding family dynamics, different family dynamics, understanding different cultures. We're both two Orthodox Jews. We're proud Orthodox Jews to make a difference in a space that when you care, we're proud that we are at the forefront and doing the right thing, not just by our patients, but as well as our caregivers.
Yes.
And that is something that the utmost important that Jack and myself have always, and it trickled down from everybody that, and we always, whenever we go into a meeting or people ask us in the street, oh, does he work for you? That terminology, was never used, they work for us.
Right.
They work with us.
They work with us.
That's Josh's
language. But we practice that.
I know, you really do.
And it starts from everybody. That means office people, and the way Jack, from an operational standpoint, people in bookkeeping love him. And there's a lot of monies, human resources, but they look up to Jack. I always felt that part, that he did not have an opportunity to see his parents grow up in the older age yet, but he saw what was lacking. He always brought that passion into the business, and we both together were able to create what we've so blessed to create.
It's so great because you're really elevating not only healthcare, but your workers, who are so important. And I know you have said they're really not applauded as they should be in most other companies. Here I see what you do, but I find that very interesting, and you're always working to better their lives as well as your clients' lives. You're always thinking of new things like our studio here.
Correct.
And that actually,
and it goes hand by hand actually, and this is a little of, we're going to go talking about the perks program, what we did. Because, an employee which is an unhappy employee, which comes into a patient's home in the morning, obviously they'll treat the patient a lot more different.
Yeah.
These patients, when an aide comes in the morning and is upset, they don't get paid properly. They're not appreciated.
Right.
They don't get that extra perks. They don't get that extra stuff. They don't get that extra smile when they come into an office or on the phone or proper customer service. They go into work and they're frustrated. Life is hectic. These are a lot of single moms, people which, can't make ends meet.
Yeah.
They're doing this job. This is a very, very hard job. So when they get like that in the morning, they get to a patient, it makes a lot of a difference. And this is where we stand out different than others and try to do, it's a big, big portion. It's not only, a lot of, when you look at home care, it's the patient.
Right.
the employee is
But you
as
look at both
important at both
sides,
sides,
Correct.
and that is a very,
I mean,
very important
we can
thing.
see it here because in our building we have some of your services.
Correct.
The gals get their hair, and guys, once in a
Yeah.
while we see guys, and their nails done. And you know what, it really does, because I could see they feel good, and like you're saying, then when they go to visit one of our fabulous clients who aren't feeling that great all the time, it's a better dynamic.
They feel they were
Yeah.
taken care of. I want to take
the
care
little
of.
things.
You know, no,
Yeah.
it's
And
a
it's not
chain
just a
reaction.
tagline.
It's a chain reaction.
Yes,
You know,
absolutely.
somebody took care of me. I'm now going to take care
Yes.
of my patient properly, of my client properly.
Absolutely, and that is
So-
so terrific. And also it's terrific that you're right here in the Bronx.
Yes.
And I know that was very important to both of you.
Correct.
Because you even said, we could have gone anywhere.
Yes.
But we wanted to be here because we felt really welcomed here.
And that goes back to, you know, there was multiple reasons why Jack and I decided to come here. The Bronx meant a lot to us. Jack and I used to come to the Bronx for years.
A lot.
And
A lot of our
from
patients and a lot of the referral sources we have
Was here.
worked very, very strongly. We always had that passion, and people liked what they have seen in our company and who
bet.
we are as operators, and they really wanted to work with us. So right from the get-go, as we were servicing the 5 boroughs, the Bronx was a very strong place where
They
we
welcomed
always
us.
serviced us. They welcomed us, and they really understood of what we want to do. And they were smart because look where the mission went. And after
Yeah.
all these years, here we are, and we're delivering a product which nobody else does.
Nobody else, right?
And the Bronx to us is, as they say, some say Staten Island is the forgotten borough, but this is such a melting pot.
Oh, yeah.
And I think a very, very large of our population that serve the elderly live in the Bronx.
Oh, okay, right.
The diversity, and we wanted to change that dynamic. And Jack and I have always been, even before we started our perks program, if the industry paid $10, we always managed to make sure that they get paid 12.
Wow.
It was never about Jack and I don't remember until only recently, because we came bigger, that we sat with spreadsheets.
Oh, okay, right.
And as crazy as that sounds,
No, I
but we
understand,
always,
yeah.
because it's a caring business, of course, we have people that in the finance, we have to
We
make
have
sure
to
of that.
right. We have to
Well,
make sure that
well,
we can
right.
pay our
Sustainability.
people. It's not just
Yes,
right. We're business
absolutely.
people, but you know what? It's not the
In
money
a caring
which is front.
business,
It's a caring
it
business.
cannot be.
Whatever has to be
Right,
done.
but it's also that you're helping the workforce here.
Yes.
I mean, you're adding to it, and you're wanting to keep the people you have. And I know that you, on the average, I think you told me your person, your healthcare worker, will stay at least 10 years.
Correct.
Which
Correct.
is sort of unheard of. in the
Retention
industry.
is the retention is unbelievable.
And-
people, they like the culture.
Yeah.
They like what would they see. They like what they get. They like what's happening around here. So, as far as the workforce is concerned, I think you can never find that somebody should say, oh, Royal Care. I'm leaving Royal Care for maybe because they got a job closer to their home or things like that.
Right.
But if somebody mistreated them or things like that or anything like in that, no.
Well,
you won't
the
get
fact
that.
that that is so important to you both speaks volumes about why you are so successful.
Right, and I
it's
want to
so
just
important.
add in reference to the retention, why some people walk the walk. Jack and I always talk the talk,
Yeah.
and we execute it. And the reasons why we actually built a tangible building to showcase that we can't say, oh, we care about our employees.
Right.
Retention to us is also, the longer a home health aide or a caregiver is with a patient, the more value they can bring back to say they picked up something, they know the patient from already a month, I don't like the way they look. And we believe, Jack and I believe that they are way underpaid.
Right.
There's no question in our mind. Jack and I advocate continuously
That's
and find
wonderful.
ways to really make sure that they get their due. And we wanted to build something to showcase that and execute on retention so they can bring us back enormous value to have patients better outcomes so they can
Right.
live happier and healthier lives at home.
I think
And that goes in obviously to the Emerest Connect thing of when it comes to savings. It comes up to a
Right.
lot of savings. If you
That's
have
right.
people which are there for a longer time, obviously the patients are taken care of better. The patients feel better, right? You
Yeah.
have a better quality.
Yeah.
Patients don't end up going to the hospital so
Right,
much.
and they don't
and
wanna
that
go,
goes
right.
into the Emerest Connect product, which we have launched, which
Yeah.
is an amazing, amazing product, where we have the clinical side and the social side,
Right.
where they really keep very, very healthy at home, and that's tremendous. So our continuum, starting with the employees, which is the you at, and keeping the employees happy, having a longer retention, getting in on the Emerest Connect side, on the patient side, to having them being more healthier at
Yes.
home. That's just
And-
it's
and-
dollars and
right.
cents across the board, which is being tremendously saved eventually,
Oh,
yeah.
yeah.
with these programs.
And people want to stay home. But I mean, if there is some kind of emergency, you have people
We
that
have-
can help them.
Intervene. We have our
If-
own
if you
ambulance.
need- if it's
yes,
needed.
So one of the real concepts, where the baby boomers are coming up.
Right, yeah.
And we wa- and we all
Yikes.
and these are coming into the age of needing care, and we
Yeah.
don't just want to treat them when they're sick. We want to prevent them from getting worse.
Right.
So the rising risk, as it's called, and that's what. And we wanted to usher in technology and innovation. We're sitting in an innovative
studio.
product.
And we had it to. There's no way in the world, and there is people which have tried years, to say we can do it without technology. But we believe, and we're actually seeing it now live,
Right.
that this technology is what's going to bring us that thing.
That connection.
That
And-
connection is
yeah.
technology, as you can see, as you're hosting these people,
Right.
On a daily basis.
Right over here,
And you're
there you go.
having,
Yes, they're watching.
They're amazing,
It's
by people
amazing.
not being lonely at home, people engaging, people doing, all these different things on the
Right.
social side, people taking care of themselves clinically, and having all those services, as you said, when it comes like small things, not to have to leave the house and just
Right.
going into an ER or to an emergency room or going to a hospital for nonsense and picking up, all these different bacteria and stuff for no good
Yikes.
reason.
Right, but
all
yeah,
those services are
absolutely.
being done through the home, and it's amazing services. So we are very, very excited to where we have gotten. As you said, we have started 20 plus years ago. Started with a non-skilled home care in New York, and branched out tremendously. Multiple states in the certified space for the last 8 years already, and in all the boroughs now, expanded to all the boroughs in New York. Looking for expansion in different states in the certified space, and having this Emerest Connect technology product, which is working tremendously and working wonders
Yeah.
in New York, and looking to expand in all the states. And so
Wonderful. And not only English, but Spanish too.
all
Yes.
languages eventually. Obviously,
wonderful.
every language, the way we are doing it, just to give you an idea, when we started and the non-skilled as well, what we realized was there's no way we can take on a group of people, we can take on a language without going all out on that language. Meaning
Right.
we don't have, like certain others would maybe have a language line, right?
Right,
There's no
right.
language line. If we have started years ago, remember, we started in the Chinese community, right? We went all out. It wasn't only that we had a coordinator which would coordinate because we wanted to save money. If we went into that line of business, population, for a better phrase, we went all out on that.
Wow.
Meaning we had payroll, HR, recruitment, everything in that language. It costed us a lot more, obviously.
right.
But you know what? We have to do, as we said in the beginning, we do what's right for the patient, for the employees, and making sense. And the outcomes are great
Right,
afterwards.
the proof is in the
proof
pudding,
is in
right?
the
Here we are.
And anything, what's coming up? I know you have so many ideas.
No,
but
I
it's
think
gotta
we're
be
going to look at Josh.
No,
He comes up with these ideas and his wonders. He
so-
doesn't sleep.
Can I just say,
Yeah.
both of you guys are so fabulous.
Thank you.
When you come to the studio, you have these great smiles on your faces, and you're so excited about about what you're doing that it is really infectious. So
Thank
I
you.
applaud
If you don't
that,
have
absolutely.
a passion to what you do,
But a lot
you
of
know
people
that thing.
do.
If you don't like,
Yeah.
if you like what you do, you don't work a day in your life.
I agree 100%.
But we want to work. We
Yes.
like to work.
And we like to build, and I
Well,
think we are trying. People have mission statements, and that's very, very nice, but it's a statement. by us is executing on that mission.
It can't just be on the wall. It has to be executed.
Right, but
and
you're
that's
always
something.
thinking and expanding.
Absolutely.
Right.
And I think
And Josh, you know, he really, you know, studies that on a daily basis, you know, to the staff and to everybody. You know, we cannot have a mission statement only on the wall.
and we lead, Jack and I lead by example. And I think
Absolutely
I'm
agree.
blessed to have a vision, but I couldn't do anything without Jack, meaning I can have a vision from here till tomorrow.
Right.
But if I don't have a partner that, not just sees it together with me,
Yeah, that's
but
true.
like I always say, I dream it, he builds it.
You know,
And we both, and there are some ideas that
you know
are
what?
really
That's
out of the
talent,
box.
actually, Josh. That's talent. He comes
What,
up
to
with the
convince
idea.
you?
Exactly. Wow. You see how he can read my mind? That's kind of talent. You know, he starts with that idea, and I'm thinking to myself, you know what? Maybe yes,
But
maybe
you-
not. Should I
you're
shut it
open
down?
to
Should I
it.
shouldn't shut it down? And by the end of the day, he gets it.
No, because and that goes back to why we have a mutual vision and a mission and really care what we do.
Yeah.
And we're very, very proud. And I think that's one thing that
And
we
you should
feel
be.
that we're different is never going away, doing the right thing. There's lots of entities out there. Nobody, and us doing it that many years, to be so involved in almost every, there's not an employee in the company, at least the people are in the offices. We have an open door policy. People come to us. There are so many things that we believe they're our family. When we hire somebody in our continuum in everywhere, it's very easy
Our
to just hire.
responsibility.
It's our responsibility.
We're very hard in hiring, and that goes back to hiring. Meaning, we don't just hire by as being so big. Usually, companies are okay.
They
We
go
need
and
that
come.
position. We need
Right.
that position. Let's get it in. We'll see if it works out. If not, we'll move on, and then move on and turn around. When we take somebody, we really take it on as a responsibility. It's a person who is coming in, training, getting it. People have families. We take on the
Right.
responsibility, and we really take it very, very seriously.
That's great.
And that's why we really see a great retention, even in office
I know
employees,
that.
not
That's
only on the aid
fantastic.
side.
The average person that works with us, not just caregivers, our numbers are absolutely amazing, but even people that in the positions, whether it's the average person that's with us is over 12 years.
That is really fantastic.
And that is a testament of what Jack and I have built, and that feeling of making sure that when we hire somebody, they're coming from another job. And just to say yes is never just the answer. How
Right.
do we see them not just staying in the job, how are they going to grow?
Yeah.
How are they going to grow within the company? Nobody wants to stay stagnant. Everybody wants to feel that their job is going
Right.
to be elevated. Nobody wants to stay in their position. Jack and I always talk about it. People want our
we do?
seats. People want our seats. And how many
If they
times?
can take it,
No, but not just
We're-
that.
we're willing to give
but
it.
Well, wait a minute. Not
there
that
are
fast.
no, but we do have we had administrators,
Right.
director of intake that grew out, and their position couldn't take Jack in our seats, but we placed them in CEO
That's correct.
positions.
Ah, that's
correct.
terrific.
That is true.
Very
Yep.
nice.
We personally put them in.
We had people which started in just a department like director of intake.
Wow.
Right? Director of
Yes.
intake, they're administrators. They became CEOs, CEOs. They
Marvelous.
did.
And we actually placed them in places that we were
Yes.
comfortable, and we still are close with them. And you know what I'm referring to. So many that we actually made sure that they can elevate them. It's not about us.
Right.
And it's
We
our.
have people which open their own businesses out of us, and we're gladly,
Wonderful.
helping
We
them
love
and doing
that.
the right thing.
We love that.
And it all started from your friendship, and it's grown.
Yes.
All right. Well, any final words for everybody?
So, Jack and myself are super proud that we're showcasing essentially our accomplishments and our
yeah.
advancements,
Wonderful.
and executing on our innovation from Royal Care to the thousands of home health aides and the patients that trust us, to us being their employer. And giving us the opportunity to care for them at home. We are always going to continue to advance their lives, home health aid lives. We're going to make sure that they feel elevated, they feel special of what they do. We will always advocate for every one of all of our employees to continue doing so. And this is just the beginning.
Ah.
Sorry, Jack.
You can have a word in, Jack. What's your final word there?
No, I think, I'll attest to what Josh is saying, that this is just the beginning. I mean, to say, with this technology is just the beginning. There's a lot coming. I mean, as, on the non-skilled and skilled, we're doing, and you were doing that for years, but this new technology stuff, there's a lot still to add to it. It's the beginning of that, and we're looking forward to make this a grand success. And we want to say thank you to all of our employees and to all of our, which are bringing out the success.
Yes. Everyone has, every single one of them has an equal amount of value that they brought to the table.
That's
every
very
single
nice.
one. And we're so grateful to everyone, and we're so proud of everyone, and we're so proud of the studio people here that deal with this.
They're behind the scenes.
Behind the scenes, and always with a smile and understanding our vision yourself. If I start names, I'll never end. But everybody has an equal amount, and we're so grateful that people see our mission and vision together. And thank you.
Thank you very, very much.
Thank you very, very much.
Thank you.
So much more.
Thank you very
so
much.
Thank you so much for all that you do. And I think these companies, they're so fantastic. I wish you both nothing but the very best for years and years to come. I hope you continue our show too, so I can.
Oh, absolutely.
All right, we're going to take a short break now.